Good morning and happy 2021 to you folks. I hope all of you are staying well, safe, and sane during this pandemic season. And I hope that most of you have already received your vaccination. I have to believe that we're off to a better 2021. So I just want to give you a quick introduction about myself. My name is Thea. I am the founder of Medicare Insurance Solutions. So what do we do here? I have been a Medicare consultant for many, many years. So I am licensed in my life and health in different states, multiple states, and appointed by many, many different insurance carriers. So my goal is also your goal, to help you simplify Medicare, give you the proper guidance, really help you pick up a plan that would work for you. We're absolutely not allowed to charge you anything. So on a personal note, I am married happily with my high school sweetheart. We do have 3 children, Marty, Kira, and Zachy, who are grown now. Our 2 adult kids also help me here. So it's very important for you folks to know that Medicare, one of my good friends told me that we are big and yet small. What that means is we're big in that we've been one of the national top producers nationwide year after year. And we're small because we provide you with personalized customer service. You don't have to be put on hold or waiting for long hold times if you need customer service. So what we do here is we will hold your hand in your research, enrollment, and beyond, and we will provide you with a lifetime customer service with your Medicare needs. So today, I will just quickly give you a quick touch on Medicare 101. I know it can be very confusing, and after my presentation, please do not hesitate to give us a buzz if you have any questions. I will share with you my screen so you can look at what I'm looking at. So here we go. So here I will discuss a guide to understanding your Medicare options. And the following presentation is for general educational purposes only. No specific plan information will be discussed. Again, please keep in mind, folks, that we are, again, licensed in many states, appointed by different carriers. So don't worry about those plans. When you call us, we can definitely provide you with more information. So like I said earlier, my goal really is to find the best plan rather, that would fit each person's needs. So I believe that each of you guys will need a different plan. You know, I don't believe in a husband and wife having the same plan, not necessarily, or you having the same plan as your friend or your neighbor. Each individual have their own unique needs, health-wise and financially. So that's where I come in. I kind of build a case, do a deep analysis to make sure that I put you with a plan that would really work for you, both financially, you know, health-wise and logistically. So now I will cover the different parts of Medicare. There are generally 4 parts of Medicare. There's Part A, Part B, Part C, Part D. So those are the 4 parts. And then there's Medicare Supplement and some ancillary plans. So let's start with Original Medicare. Original Medicare are A and B. And then the plans that you purchase through private insurance carriers are your Medicare Part C, Part D, Medicare Supplement, and ancillary plan. So I will discuss those in the next slide. So keep in mind, again, your original Medicare that comes from the federal government are your Medicare Parts A and Part B. Medicare Part A only covers inpatient hospital, skilled nursing facility, home health care, and hospice care. Please keep in mind that Medicare Part A does not cover long-term care facility. Skilled nursing is very short-term rehab center. And then Medicare Part B, like in baby, is really anything under medical. Your doctor's visit, outpatient care, durable medical equipment, some preventive services, your MRI, your CAT scan, outpatient surgery, ambulance, therapy, etc. So this is the basic general overview of Medicare Part A and Part B. So now we can dive deeper on what is Part A. Here we go. So Part A, again, covers, like I said, hospice care, home health care, skilled nursing, and inpatient hospital. How do you enroll for Part B? Enrollment is automatic if you are already receiving your Social Security benefits prior to turning 65. Otherwise, you must enroll through the Social Security office. Is there a premium? So for most of you folks, a lot of you have worked in the United States for 40 quarters or 10 years, which means you've paid into the system. So generally, when you turn 65, there really is no premium for Part A if you have paid into the system. But if you have not, then the standard Part A premium this year is $471 each month, okay? Now the Part A deductible is $1,484. That is per benefit period, okay? But that doesn't cover you in full, because if you were to be hospitalized, you have to pay that $1,484 deductible. And then after 60 days, you will have a copay of $371 each day. After 90 days, then you pay $742 each day. And there is no cap, or there's no out-of-pocket maximum. So this is a basic overview of Part A. I will now move on to Part B. Part B, like in baby, really, again, is anything under medical. Doctor's visits, surgery, emergency, therapy, blood tests, x-rays, ambulance, anything under medical, okay? You must pay a Part B premium. And the Part B premium will depend on your adjusted gross income from the past 2 years. So it's 2021 now, they will base it on 2019, okay? If you are receiving Social Security benefits, once you activate Part B, Medicare will automatically deduct it. If you are not, then they will be sending you a quarterly bill by mail. Now, does Medicare Part B cover you in full? Absolutely not. If you continue with just Part B, you will be responsible for a standard Part B deductible of $203, and then Medicare only covers you 80%, so then you are responsible for 20% that Medicare does not pay, okay? So now I will proceed to the next slide, which is going to be very interesting, just so you know how much is Part B going to cost you once you've activated it. Here we go, guys. All right, so like I said, your Part B monthly premium will depend on your 2019 adjusted gross income. If you belong to a higher income bracket, then you pay more than the average monthly Part B premium of $148.50 per month. So you can take a photo of this. What I did was I added the Part B income related monthly adjusted amount to the total Part B premium here to make it easier for you. So for those who have filed individual tax return with an adjusted gross income, I will call that AGI, of $88,000 or less, or have filed joint tax return of $176,000 or less, your Part B monthly premium will be the average of $148.50 per month rather, with no Part D income related monthly adjusted amount. So what does this mean? When the government determines that you belong to a higher income bracket and you activate your Medicare Part B, or you enroll with a standalone drug plan, it triggers the IRMA. Again, IRMA stands for Income Related Monthly Adjusted Amount. So let's move on to the next income threshold. For example, for those individuals who's had an AGI of between 88,000 and 111,000, or who have filed joint tax return of above 176,000 up to 222,000, your Part B premium will be $207.90 each month. On top of that, once you enroll with a drug plan, because you have to sign up, well, it's not mandatory, but if you don't sign up for a drug plan, there are additional penalties. So once you sign up with a drug plan, there will be a separate premium for that. But on top of that, it will trigger this additional $12.30 each month, and so on and so forth. So if your adjusted gross income individual is 500,000 and above and filed joint tax return of 750,000 and above, you will belong to the highest income bracket with a Part B premium of $504.90, but it will trigger this additional Part D income related monthly adjusted amount. So it is very important. This is what IRMA means. Most people pay the standard premium amounts, but if you are a higher wage earner, you may pay the extra amount each month for Part B and Part D. So it's very, very important to contact the Social Security office because they can determine that for you. That toll-free number is 1-800-772-1213. Again, that number is 1-800-772-1213. And you can also file an appeal to lower that Part B premium if you expect a decrease in income, such as perhaps a retirement. You can also give us a call. We do have the forms and we can help you reduce the Part B premium. All right, so now moving on to Part D like in David. So Part D like in David is generally those medications that you pick up at your local pharmacy. So these pertains to like your generic along with brand name drugs that's included in the plan's formulary. How do you enroll? So you have to choose to enroll. The only folks who are automatically enrolled with the drug plan are those with some type of state assistance. But you may also want to check also because sometimes all Part D insurance carriers have different drug lists, drug tiers, and formularies. So you just want to make sure your medications are covered. Is there a monthly premium? Generally, yes. Medicare Part D usually will have a monthly premium, and then you also will have your own share of costs. We call that your either copay if it's a flat dollar amount or a co-insurance if it's a percentage amount. So that's how it works. But if you enroll with Medicare Advantage plans, which we'll cover shortly, some of those plans are available at zero premium. Moving on to the good old donut hole or the coverage gap. So I know this may sound overwhelming or confusing, but the donut hole have been in existence for quite a few years now. So hopefully the government may get rid of it shortly because they're slowly closing the gap. But I will try to explain this as best as I can and as simple as I can. Medicare states that no matter what drug plan you pick, again, it's very important, while it is not mandatory to pick up a drug plan, if you don't, you run the risk of running what's called a late enrollment penalty in the future. The government will penalize you for not having a drug plan, okay? Now, also keep in mind, if you belong to a higher income bracket, it triggers the IRMA that we've covered earlier from the previous slide. So again, going back to this coverage gap or the donut hole, what Medicare is saying is once all of your drug costs have added up to their threshold, so they set the threshold to a threshold of 4,130, at that point, you are no longer subject to, low or flat copays. All of a sudden, you pay 25% of the cost, whether it's brand or generics, until the total drug costs have reached the second threshold of $6,550, at which point the copays just drop down to either 5% of the cost of the meds or $3.70 for generics and $8.95 for all other medications for brand drugs. And most Part D plans have a $445 drug deductible. This is the standard structure of Medicare. Okay, now insurance carriers are allowed to design their own, but they have to follow the standard structure. Okay, so now that we've established what Medicare does not pay, so keep in mind, these are the coverage gaps that we may need to cover, or you may need to cover. So original Medicare has several gaps in coverage, which makes private Medicare plans attractive. So you may want a plan that will cover your doctor visit copays, coinsurance deductibles, your prescription copays, your hospital deductibles, and by the way, dental, vision, and hearing, those are really generally not covered by Medicare, okay? So now we've established the fact that Medicare, original Medicare Parts A and Part B, they really don't cover you in full. So what do you do? One of the options is a Medicare supplement or Medigap. A Medigap plan is designed to cover just medical and hospital. The beauty about a Medigap plan is it's not a managed care plan. Keep in mind, folks, Medicare is still the largest insurer nationwide. So with a Medigap plan, Medicare will simply be your primary payee, and a Medigap's job is to just cover the gap. So if you want the ultimate freedom, flexibility, and peace of mind, this is the way to go. There will absolutely be no network providers, no referrals, no prior authorization, no claim forms. It will simply give you the freedom and flexibility to be able to go to just any providers anywhere in the United States who accepts Medicare as primary, and a supplemental plan will simply cover the gap, okay? So another tip, it is very, very important that in all 50 states, generally, except if you're a resident of New York, Connecticut, Massachusetts, some other have some birthday rules, but this is the general rule. The only time you can purchase a supplement plan without going through medical underwriting or any pre-existing condition clause is really within 6 months of the Part B effective date and within 6 months of turning age 65. So please do not lose your one-time, once in a lifetime, we call it open enrollment period, okay? So to reiterate, Medigap plans will cover your deductibles, copays, coinsurance for Parts A and Part B. Like I said earlier, you really can see any doctor that accepts Medicare. Plan benefits are standardized. So that what makes us different is we don't have a bias. Like I said, we're appointed by so many Medicare insurance carriers. So we do the shopping for you and we look at the ratings of each company. But for example, a Plan F is a Plan F will give you the exact same benefit whether you're going for company XYZ or company, DEF. It's the exact same plan. They are allowed to differ in premiums, but not in terms of the benefits. And then it's also very important that you have to purchase a separate drug plan, which is available through national and regional health plans. So what you get here is it fills in the coverage gaps of Medicare and some additional benefits as well. So that's how Medigap plan works. And here is a quick cheat sheet of how it works. So basically with Medigap plans, the top of the line plan was Plan F like in Frank. Plan F like in Frank covers all of these. Part A coinsurance, Part B coinsurance, blood, Part A hospice, skilled nursing, Part A deductible, Part B deductible, Part B excess. So it used to be kind of what we call the Cadillac plan. It covered, well, it still is. It covers 100% of what Medicare A and B does not pay. However, January 1st, 2020, the government has not allowed or has stopped making new Medicare beneficiaries has no longer allowed new Medicare beneficiaries to purchase the supplement plan F. Those who are new to Medicare starting January 1st, 2020, because of the macro rule, MACRA, you folks are no longer allowed to purchase the supplement plan F, but it's okay. This is not something that you should be concerned of because you can still purchase a supplement plan G like in George. Plan G like in George is generally $30 to $50 less in terms of premium per month. But the only difference is that, again, Plan G will cover all benefits 100%. I'm sorry, Plan F will cover all benefits 100%. Plan G will just not cover a $203 standard Part B deductible. And yet it's cheaper in terms of premium. So we can dig deeper into these different options, but the top three plans as of today are your plans F like in Frank, G like in George, and N like in Nancy. So that's the first option. Keep in mind with a supplement plan or a Medigap plan, Medicare supplement, Medigap, they're one and the same. It covers the gap or it supplements what Medicare does not pay. So just keep in mind, if you go this route, you need to purchase a separate Part D like in David plan for your medications. All right, so moving on to the other options. So like what I said earlier, keep in mind you have two options. You either pick a supplement plan with a drug plan, or you can pick a Medicare Advantage or a Part C. Medicare Advantage is known as the Part C like in Charlie of Medicare that covers your A hospital, B medical, and D prescriptions under one plan. Keep in mind these are managed care plans. So if you go this route, while you are not losing your Medicare benefits, you will only use one ID card to go to your doctor, specialist, hospitals, and pharmacy, like a regular insurance. So clearly it tells us here that it does replace original Medicare with HMO or PPO offered by private insurers. These are low or no premium plans. There are some zero premium plans in most areas. Most plans include prescriptions. So there are Medicare Advantage plans that do not include prescriptions, but truly those are only designed for VA beneficiaries because they're able to, cover their prescriptions through their VA benefits. Many plans include annual physical, dental, and vision coverage as well. And what you get are coverage for Medicare Parts A and Part B and some additional benefits as well. So these are samples of Medicare Advantage plans, just some examples. There's a private fee-for-service plan, there's a preferred provider organization, and there's health maintenance organization. So PFFS plans cover visits to really any providers who first, these are called deeming providers. They must accept the plan's terms of payment, okay? PPO basically gives you more freedom and flexibility because you do have the ability to go in or out of network. However, it's very important that you will pay less if you go to an in-network provider, and it usually includes a prescription drug plan, integrated with the plan. Now, HMOs are kind of more restrictive. They typically have less premium and less copays, but it's very important to understand that with HMOs, except for emergencies, an HMO will only cover care that is provided by your PCP, specialists, or hospitals in the plan's network. if you go outside of their network or if you go to providers that are not contracted with their plan, then neither Medicare nor the plan will pay. How do you enroll? You must choose to enroll with a plan. You must have Medicare Parts A and Part B and must live in the service area. Is there a premium? Each plan sets their own premium, but keep in mind, if there's a premium, that is on top of your Medicare Part B premium. Is there a deductible? Some plans are allowed to have a deductible in terms of prescription and medical and hospital as well. Is there a co-insurance? Again, it's determined by the plan, but all of these have to be pre-approved by the Centers for Medicare and Medicaid Services. So we now move on to different enrollment periods. So it gets more confusing because I covered the fact that there are different parts of Medicare that's coded by letters. And now the general period is also coded by letters. We have IEP, GEP, AEP, SEP, and OEP. So what does it stand for? Initial enrollment period stands for really new to Medicare. This must occur 3 months prior to a person's 65th birthday after, but your A and B must have the same effective date. And then there's what we call general enrollment period. So this applies to those who never signed up for their Part B past or at age 65 and did not continue to have a credible coverage. Say you skipped enrolling with a drug plan after retirement, or with Part B rather, after retirement. The only time you can enroll with Part B, like in baby, or even Part A, is from January 1st through March 31st every year. But keep in mind, your Medicare will not begin until July of that same year. And then there's what we call, one of the most popular enrollment period is annual enrollment period. This occurs from October 15th through December 7th. This is the time can switch, add, change, or drop their Medicare Advantage or prescription drug plan. Please keep in mind that this does not necessarily fall or pertain to Medicare supplement plans. The AEP that occurs annually is generally only for Medicare Advantage and Medicare prescription. And then there's what we call the special election period. Special election period only pertains to a life event. So for example, if you've had Medicare and if you already have a plan, you can make it based on a life event, a special circumstance, such as if you've moved, if you've lost coverage, or even if you currently have any type of state assistance, you can do that too. And another one called the Medicare Advantage Open Enrollment Period. Open enrollment period really only pertains to those folks who currently hold a Medicare Advantage plan. You can disenroll and pick up a drug plan, or you can switch to another Medicare Advantage plan only from January 1st through 1st as well. So here we go. How do you, we've discussed this, we've covered this for a bit earlier. If you are receiving Social Security benefits, when you turn 65, enrollments in Parts A and Part B is automatic. So you should be receiving about 90 days from the month you turn 65. You should be receiving your red, white, and blue paper ID card in the mail. So don't toss that. If you are not covered by insurance when you turn 65, it's very important to sign up for Parts A and Part B to avoid a penalty. The penalty is not fun. It's about 10%, so to do this. Enrollment with a drug plan is never automatic, unless sometimes the government enrolls you if you have a state assistance. If you wish to enroll in an Advantage plan, you must have both Medicare Parts A and Part B. If you wish to purchase a Medicare supplement or a Medigap plan, there is a period of guaranteed issue that coincides with your enrollment in Part B once you are at least 65 years old. Beyond that period, you are subject to health underwriting before you can enroll in a Medigap plan. It's called the open enrollment period. Okay? So there's more good stuff that we will cover here. What are the penalties? So again, for Part A, it's a 10% flat amount if you're not eligible for premium-free Part A. For Part B, it's 10%, and for Part D, it's 1% incremental. So I know this cheat sheet kind of really looks confusing. I suggest that you give us a call back with any questions. I will move on with a quick case study here. So for example, Jane Smith is covered under husband's health insurance and is age 70. She lives in Pittsburgh and she's only enrolled in Part A. Between Jane and her husband, they pay $600 a month for their health insurance. Her husband's employer's open enrollment period began at the beginning of the month. What should she be considering? She can remain on her husband's health coverage until he retires and enroll in Medicare at that point without penalty. This is a very common question that happens every day. So anybody who does not have, or who's still actively employed, or is a dependent on a spouse, such as Jane, who is still actively employed, for as long as your employer plan is credible, you are allowed to stay with that plan without having to worry about any future penalties, especially if you work or your spouse works for a group of employees that has over 20 employees for large companies. It is always best to refer with your HR benefits to make sure that you are not required to activate Medicare and that it is a credible coverage, okay? Another option for Jane is that she could drop his coverage, the husband's coverage, and sign up for Part B with no penalty and consider a supplement plan, which is going to cost her. So a Plan F, like in Frank, remember what I said, Plan F will cover everything 100%. A Plan F, like in Frank, for a 70-year-old non-smoker female at zip code 15106 would cost a total of $270 per month. That means 121 Part B premium. This was many years ago. The Part B premium now is $148.50, by the way. So going back to this example, it's going to be $121 Part B premium plus about $150 for Plan F. Keep in mind, Plan F covers all of her medical and hospital bills 100%. So she should also consider Part D, which is about $30 per month. If she is considering dropping from his coverage, she should inquire how this will affect his premium and what other benefits she qualifies for and may lose if she were to drop off his health plan. I'm going to provide with one more very, very important example. For those of you folks who have an HSA, a health savings account, listen up. Mr. Green owns a business with 75 employees. He and his wife are both covered by the plan that he offers to all employees. What options would Mr. Green have when he turns 65 if he decides to continue working and defer Social Security? So option A, both Mr. and Mrs. Green can enroll in Part A of Medicare when they turn age 65 and defer enrollment in Parts B and D until they terminate group coverage without penalty. However, if the plan is consumer directed with an HSA, the Greens should consider deferring enrollment in Part A, as they would be prevented from making further contributions to the HSA if they participate in both the group plan and Part A. Any balance left in the HSA plan at the time the Greens enroll in Medicare could still be drawn in the future. So to simplify this, for those who have an HSA and your employer is contributing to that HSA, it is very, very important that please do not activate Medicare Parts A and or Part B, okay? Option B, both Mr. and Mrs. Green can enroll in Parts A and Part B of Medicare when they turn 65 if they drop their group coverage. They should also consider purchasing a Medicare supplement with a drug plan or a Medicare Advantage plan that includes prescription drug coverage when they first enroll in original Medicare. So that's a wrap for now. If you have any questions, like I said, I would definitely be more than happy to assist you. We're here to hold your hand in your research, enrollment, and beyond. And we are committed to providing you with full customer service throughout your lifetime. We will review your plans year after year. So please do not hesitate to give us a call. Our website is www.medicaretlc, that's 1011 here, www.medicaretlc.com. I also ask you to please read our Google reviews. We hope that you can join us and join our group of happy clients. So all you have to do is Google us. That's med-i-care-insurance-solutions.com. And please like us or follow us on Facebook as well. Our direct line is area code 864-625-2112, 864-625-2112. And our toll-free number is 888-208-7614, 888-208-7614. My name again is Thea. I am the founder and CEO of Med-I-Care Insurance Solutions. Thank you for your time today, and I hope you give us the opportunity to be your partner and teammate for life with your Medicare needs. Have a great day. Stay well, stay happy, and safe. Take care, folks. Bye.